If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org. This podcast is supported by our sponsor partner Medtronic, maker of InterStim systems for bladder and bowel control. To learn more about InterStim therapy, visit controlleaks.com. Welcome to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us today is Dr. Kathleen Kobashi, a good friend of the podcast and chair of the Department of Urology at Houston Methodist Hospital and a specialist in women's health and bladder control issues, here for another conversation today, in particular about misconceptions regarding incontinence. So welcome, Dr. Kobashi. Thank you for joining us.
Thank you so much for having me.
So, Dr. Kobashi, what are some of the common misconceptions about urology?
Well, I think first and foremost, people really think about urology as a male field, or that the patients are primarily male. And while there are a lot of males who need urologists, it's absolutely true that women can use a urologist as well. I mean, so bladder control issues and prolapse and that sort of thing can all be taken care of by a urologist. So easily, in my practice, it's about 70-30. I mean, I see a lot of men and I enjoy seeing the male patients also, but primarily I see women. So I think that's one misconception that stops a lot of people from seeing the urologist in the first place.
I'm interested in the gender issue because, there's a lot going on here. You have you yourself as a woman practicing as a urologist in a field that's largely male practitioners, and you have patients who I imagine there's often a lot of sensitivity about, does a woman want to be seen by a man or a woman, or does a man mind being seen by a woman? Or what do you see from your perspective when it comes to that?
Yes, I mean, I think the world is changing every day, as you know, but and some people do have a strong preference to see a female or a male. We absolutely try to accommodate that. Nowadays, the number of women urologists, female urologists in our sort of workforce, I guess, is just over 10%, which is a huge improvement or increase over what it was just a few years ago. So our latest AUA census, the American Urologic Association, does a census every year to take a look at what our workforce looks like and what our practices look like. And we've just for the first time surpassed 10% women out of, I think, 11,000 or 12,000 urologists in the country. So we're getting better. I think the younger group is much more hip and progressive. And so the number of applicants that are coming, the proportion of applicants that are women that are coming through now is getting much higher. So while the workforce is just over 10%, the young generation is bringing in a lot of new young energy and a lot more women in that group.
And in addition to gender, there are also, there's so many other traits that people may want to be looking for to find somebody who they feel understands them as well as possible in terms of age and race and ethnicity and things of that nature. Is the field in those regards also sort of diversifying so that people have a greater number of options that really fit their own taste and temperament?
Absolutely. There's been a concerted effort, a real focus on diversity and equity, not just in urology, but across the medical field for sure. And urology, I've got to really commend the leadership, the executive leadership of the AUA, and all the societies have really been working hard to do that. The American Board of Urology, I know, has a concerted, a campaign to try to really attract people who typically wouldn't have even been exposed to urology. And so I think, yes, we're moving in the right direction. Maybe not as fast as we would all like, but at least we're doing it in a very purposeful way. And it's really refreshing to see that.
So a patient walks in your door and they present some sort of an issue. What are the things that they are most misinformed about? What are some of the myths or fears or other things that they just don't understand the reality of?
I think the main thing is that there's a lot of thought specific to what I do, which is, bladder control issues and lower urinary tract function. I think people think it's a normal part of aging, or many people think it's a normal part of aging because, you go to the supermarket and you see pads all over the place and you see commercials for pads on TV, and it sort of normalizes it. It makes it sound like that's the solution. And we've got plenty of things that we can do to successfully treat different reasons for bladders not behaving properly, and help them with bladder control. So I think it's a shame if people decide they don't want treatment, that's one thing. But if they don't know that there are treatment options to consider, that's a real shame. So we've got some work to do to get the word out there that we've got successful things that would render them, that would make it so that they wouldn't need to use the pads at all in the first place.
That's a pretty hopeful message. I mean, especially if you do have patients who are coming in who've gone for years thinking that there's nothing that can be done.
100%. I agree. Well, it used to be in the dark ages when I was in training, there used to be like one medication or two medications, and then a big surgery. And that was it. And now we've got all kinds of things that there's been so much attention being placed on patient quality of life and things that we can do to improve that there have been improvements and advancements within this particular field rapidly so in the last couple of decades. So many things that we didn't even have to offer before are now, sort of are part of our normal armamentarium to deal with leaky bladders.
And I suppose we could talk about reasons why people aren't always aware of some of these options, but I'm wondering, do you find that it's, once you do present them, do you find that it's sometimes hard to sort of convince them that, yeah, this is a legitimate thing, it really works, it's really worth giving a shot to? Is there some resistance there?
Well, there's different presentations of patients, right? There's a patient who comes in and says, I'm not really sure why I'm here. My primary care doctor told me to come. And then you have to figure out that. And then there's a patient who comes in and they're like, I'll do anything if you can help me. So, I think what we have to do is sort of figure out where the patients are in their journey and then help them understand that we have things to offer. And, when you look at the AUA guidelines, American Urologic Association and SUFU guidelines, we've accounted for the subjective piece of things, meaning how much does this bother you? If it doesn't bother you, even if you leak 6 pads a day, if it doesn't bother you, we don't have to fix it. But if it bothers you, there are things that we can do. And then you go on to tell them about it. I think another issue is how we present it to the patients, right? I mean, we want to make sure that we present things to the patients in a way that's very friendly and not intimidating language. So for instance, when I tell patients about, we have a pacemaker for the bladder for patients who have overactive bladder, they've got frequency and urgency and they just can't get to the bathroom in time. And it starts before they get there and they can't control it. If medications don't work, we've got several things that we can do, one of which is a pacemaker for the bladder. And the language that I use, I'm talking about this only because I want to tell you about the language that we use, is we've got a little pacemaker about the size of an Oreo cookie. And we put it in under anesthesia. That's just sedation, just like when you get your wisdom teeth pulled or you go get a colonoscopy. It's just a little sedation. We do it in the operating room, not because it's a big operation, but because we need it to be sterile since we're implanting something. So, so that language, rather than saying, oh, we're going to put a pacemaker in your back, a computer in your back or something, you can make it really not attractive, or you can make it very friendly and less intimidating.
I love that phrasing there, how you call it a pacemaker, because that's something people are already familiar with. Plenty of them have had it done themselves anyway. So that probably overcomes a big barrier. That, it makes it relatable. I think that's an outstanding way to put it. I love hearing that.
Thank you. It's funny. I had one patient the other day when I said, it's about the size of an Oreo cookie or a silver dollar. I'll use silver dollar. But the Oreo cookie, one of the patients said to me, is it single stuff or double stuff?
Well, that is better than silver dollar, because nowadays I don't think anybody's seen silver dollars for years.
That's right.
Well, Dr. Kobashi, thank you so much for your insight. I really appreciate it, and I hope that it helps some patients get a better sense of what the reality is when it comes to dealing with their incontinence. So thank you for joining us again. Really appreciate it.
Thank you so much for giving me the opportunity to talk with you today.
Life Without Leaks has been brought to you by the National Association for Continence. This podcast was supported by our sponsor partner Medtronic, makers of the InterStim systems for bladder and bowel control. To learn more about the InterStim systems, visit controlleaks.com. Our music is Rainbows by Kevin MacLeod and can be found online at incompetech.com.